If you're experiencing gum recession in your lower front teeth, this might be the most important video you watch before making any treatment decisions. Here's why your lower front teeth are different and what you need to know. What we call the mandibular anterior area is an area that is just a little bit difficult for gum grafting. So this is actually patient number 1. She's experiencing gum recession down here. You could see that she has a frenum attachment really close to that. And what the frenum is, it's a muscle that connects basically from your gums to your lip. And if that frenum attachment tends to go too close to the teeth, that can create issues, especially in your lower front area. It has a tendency to want to pull your gums away. If you're starting to pull your gums away, then you're also experiencing bone loss behind the scenes. Now the question is, how do we treat it? A lot of patients know about gum grafting, but there's different types of gum grafting. Option number 1, the free gingival grafting. Option number 2 is what we call connective tissue grafting. And that free gingival grafting is done in areas that have no keratinized gingiva. It's the thicker pink tissue that's closer to your actual teeth. Nature's evolved a way for you to have nice thick pink tissue so that if you get some sort of injury or you poke it with something hard, your gums are not going to start eroding immediately. So that's basically nature's collar for your teeth. The roof of your mouth has a ton of keratinized gingiva, and we can actually do a transplant down to that recipient area. The problem with this procedure is that when we get this tissue from the roof of the mouth, it can be a little bit uncomfortable. People say it feels like a pizza burn. The other downside is it tends to bleed a little bit more. Let's talk about option number 2. It's a connective tissue graft. Instead of grabbing the surface layer from the roof of the mouth, we're going to grab the middle layer, connective tissue layer, right underneath the epithelium. You're going to have less discomfort and less bleeding and more advantageous in all senses. But here's the problem. The lower front jaw area is less vascular, less blood supply. And having better vascularity is always going to be a good thing whenever we're talking about any type of surgery. So because the vascularity is affected, that kind of affects how connective tissue grafting is going to heal in that area. Another more important factor is going to be the frenum attachment, that muscle pull. If there's too much tension or pull in that area while we try to do this type of gum graft, and that's going to affect healing. As a result of that less vascularity, you have a higher tendency to see relapse. Patient number 1 is asking about the pinhole procedure. With what we got going on, the pinhole is an absolute garbage. There's no way that that's going to have a good result without sutures. Then led into conversation about human donor tissue. It's cadaver tissue. The history with allograft is that it was used on burn victims about 20-25 years ago. They started using it on gum grafting patients. The types of materials have evolved, but studies have shown that over the years that there tends to be more relapse when you don't use your own tissue. And even if you were to get a good result, the other issue is that you're going to see more relapse over time.